One of the major causes of acne is genetics. Okay, if I see a mother and father with, they come in with their child, and you can clearly tell that they had bad acne growing up, and generally they volunteer that information. We have a tendency to want to treat that acne more aggressively early on, but just being a teenager generally leads to most acne. But I also see adult men and women who have been suffering from acne their entire life. As I explained to teenagers, the same things that make the muscles and bones grow are the same things that influence how productive oil glands are. More productive oil glands means that there's a higher likelihood that those oil glands are going to be obstructed and then ultimately lead to acne. One thing that I pride myself on doing when somebody comes in to have acne evaluated is making sure that they are fully aware of what their options are and how aggressive they want to be in treating their acne. There are some people that aren't bothered by their acne. We all know that someone's not going to die from their acne, but it can be bothersome. It can affect personal outlook. It can actually lead to depression. There's a lot of hype out there about how some of the medications we use can cause depression, but what we don't think about is what acne does to somebody, especially when it's severe and it's painful and it's scarring. So we do what we can to be as aggressive as the patients want us to be in treating their acne. If you're not bothered by your acne, typically I don't see those people. But when you are bothered by your acne, we talk about all the treatment options, and we make sure that the patients have input. They are participants in making treatment decisions, for their acne.